Grapeseed extract is a concentrated source of antioxidant polyphenols. Grapes and other berries have specific polyphenols and proanthocyanidins. They're responsible for the dry mouth sensation that you get from drinking red wine or berry juice, but they also act as potent antioxidants. Grapeseed extract can help lower blood pressure, protect the brain, heart and blood vessels, protect the liver and kidneys, and support wound healing. Oxidative stress lurks as an underlying cause of many health conditions. Grape seeds are among the best source of powerful antioxidants, proanthocyanidins, which build oligomeric proanthocyanidin complexes, or OPCs, with unique antioxidant properties. Phenolic acids and flavonoids from grape seeds also combat oxidative damage. Apart from free radical protection, this unique mixture of grape seeds components can relieve inflammation and allergies, kill microbes and cancer cells, and protect healthy cells against toxins and radiation. In 36 subjects, 1 month supplementation with grapeseed extract at 2 grams per day protected blood vessels against free radical damage by boosting nitric oxide levels. In a series of smaller clinical trials, grapeseed extract lowered the risk of heart disease by lowering oxidative stress and inflammation. It prevented the oxidation of LDL, or bad cholesterol, in the blood vessels. Oxidized LDL can trigger plaque buildup or arteriosclerosis. Animal trials have confirmed the ability of grapeseed extract to protect the heart and the blood vessels against LDL oxidation, clogging and hardening of the arteries, drug-induced damage, damage due to heart attack, and lead poisoning. 2 meta-analyses of 25 clinical trials concluded that grapeseed extract can lower blood pressure. The effect was stronger in younger participants, obese patients, and those with metabolic disorders. In 36 patients at risk of high blood pressure, an extract 300 milligrams daily for 6 weeks reduced blood pressure and lowered their risk. In deep vein thrombosis, a blood clot from the legs can get stuck in the lungs and cause a life-threatening condition known as a pulmonary embolism. Grapeseed extract at 400 milligrams a day for 8 weeks had blood-thinning effects in a study of 17 older women. This effect could potentially lower the risk of blood clots and vein thrombosis, which are much more common in older postmenopausal women. In 16 younger women, both acute and 2-week supplementation with grapeseed extract reduced leg swelling after prolonged sitting. In rats with deep vein thrombosis, the extract prevented the formation of blood clots. It also inhibited blood clotting in many cell-based studies. The best evidence for grapeseed's benefits comes from studies on deep vein thrombosis and other circulatory conditions. In a meta-analysis of 9 clinical trials with 390 participants, grapeseed extract had no effect on blood lipid levels and C-reactive protein, which are markers of inflammation. In over 100 patients, supplementation with grapeseed extract enhanced cognition and reduced the symptoms of stress and depression. In animal and cell studies, these extracts protected brain cells against oxidative damage and death that was triggered by different toxins. The National Centre for Complementary and Integrative Health supports preliminary research on grapeseed extract for Alzheimer's disease. The culprit of Alzheimer's disease is age-related cognitive decline caused by protein mutations and free radical damage in the brain. Polyphenols from grapes and blueberries at 600 milligrams daily for 6 months relieved cognitive decline and memory loss in 215 older patients. This potent antioxidant mixture showed the same result in mice. In animal models, grapeseed extract lowered the risk of Alzheimer's disease by reducing free radical damage in the hippocampus, the brain's memory hub, raising the level of antioxidants, preventing protein mutations, and boosting the animal's cognition and memory. In 40 patients recovering from surgery, grapeseed extract in a 2% cream enhanced wound healing by stimulating VEGF production, blocking oxidative damage and fighting microbes. It showed the same effect in 2 animal studies. Grapeseed extract ointment at 5% significantly improved wound healing after a C-section in a trial on 129 women. In a few clinical studies, creams and ointments containing grapeseed extract appeared to improve wound healing. In 15 patients with fatty liver, grapeseed extract dropped liver enzymes and reversed fat buildup. It showed better results than vitamin C. Thanks to its strong antioxidant action, grapeseed extract shielded the liver of lab animals from damage caused by bile duct obstruction, heavy metals, acetaminophen poisoning, cut off blood supply, and chemicals. In mice, it outperformed vitamin C, vitamin E, and beta-carotene in protecting the brain and the liver against oxidative stress. Aflatoxins are dangerous mold toxins that can wreak havoc on the liver and even cause liver cancer. In studies on chickens, grapeseed extract prevented aflatoxin-induced damage. In a clinical trial of 33 patients with kidney disease, grapeseed extract enhanced kidney function by providing antioxidant and anti-inflammatory support. In animals, grapeseed extract protected the kidneys from toxic drugs and high cholesterol. It worked by lowering markers of inflammation, raising protective molecules, boosting kidney function, and preventing LDL oxidation and its buildup. Grapeseed contains procyanidins. These are powerful antioxidants that support hair growth. An extract of procyanidins boosted hair growth in a trial on 250 men. Grapeseed extract and isolated procyanidins stimulated the hair follicles and enhanced hair growth in different animal and cell-based studies also. In 51 overweight patients, grapeseed extract slightly reduced food intake but did not impact appetite. In animals on a high-fat, high-sugar diet, grapeseed extract blocked fat buildup and production in the liver, enhanced fat burning, lowered the levels of cholesterol and blood lipids. But one study revealed puzzling results. Low doses of grapeseed extract lowered inflammation, but increased body fat in pregnant rats and their offspring when it was combined with a high-fat diet. Moderate sunbathing is essential for your vitamin D production and overall health and well-being. On the other hand, excess UV exposure can cause sunburns and skin damage. The skin of 10 volunteers treated with grapeseed extract before UV exposure had fewer mutated and damaged cells and more healthy ones. The extract also prevented UV-induced skin cancer by blocking oxidative damage and inflammation in many animal trials. In 12 women supplementing with grapeseed extract at 200 milligrams a day for 6 months, it lightened the skin and reduced face spots. In combination with other antioxidants, it improved skin complexion in 35 women. They were able to get rid of dark circles, face spots, and other skin imperfections. The majority of women, 82%, were satisfied with the results. In a handful of very small clinical studies, grapeseed cream and supplementation improved skin damage due to UV light and aging. In male rats, grapeseed extract recovered testosterone levels and prevented testicular damage that was caused by chemotherapy and other drugs, by injury, and by toxic chemicals. According to some animal studies, grapeseed extract can inhibit an enzyme called aromatase, which converts male hormones, or androgens, into female sex hormones, or estrogens. This effect could, in theory, raise the levels of testosterone and protect against breast cancer. In diabetic rats, grapeseed extract lowered blood glucose, cholesterol, and lipids while boosting insulin secretion and antioxidant support. The extract had the same effect on animals with insulin resistance, caused by a high sugar diet. It prevented blood glucose spikes and restored antioxidant enzymes such as catalase and SOD. Grapeseed extract protected diabetic rats and mice against an array of complications like heart disease, bladder dysfunction, brain damage, neuropathy, lung impairment, and nephropathy. In rats and mice with rheumatoid arthritis, grapeseed extract improved symptoms and reduced autoimmune joint destruction. It lowered the levels of inflammatory molecules, and it silenced Th1 and Th17 autoimmune responses. In another study, it protected rats against a different joint disease, osteoarthritis. The extract reduced joint pain and cartilage degradation. Additionally, grapeseed extract strengthened the bones and boosted their growth in several rat studies. In animal studies, grapeseed extract reduced tissue destruction in rheumatoid arthritis and osteoarthritis, strengthened bones, and reduced joint pain. Widespread autoimmune inflammation and oxidative stress cause severe gut damage in Crohn's disease and ulcerative colitis, the two main forms of irritable bowel disease, or IBD. Dietary antioxidants are being researched as a complementary approach to IBD. In rats and mice with IBD, grapeseed extract tightened the gut lining, cut the levels of inflammatory markers, restored the gut microbiome, and reduced oxidative stress. Grapeseed extract relieved airway inflammation, the IgE immune response, and mucus production in asthmatic rats. In test tubes, it inhibited the release of histamine and other inflammatory components from mast cells, which play a central role in the allergic response. Lipopolysaccharides from the cell wall of gram-negative bacteria, like E. coli and Salmonella, can trigger inflammation and cause different symptoms of bacterial infection. Grapeseed extract controlled the inflammatory response and boosted glutathione in rats that were infected with lipopolysaccharides. In lipopolysaccharide-infected blood cells, the extract inhibited inflammatory molecules also. In test tubes, grapeseed extract suppressed the growth of Bacillus cereus, which causes diarrhea and foodborne illnesses. Staphylococcus aureus, which infects the skin, the lungs, and soft tissue. E. coli, which triggers UTIs and gut infection. And Pseudomonas aeruginosa, which causes dangerous infections in hospitals. It's even been shown to kill drug-resistant superbugs known as MRSA in one experiment. In large observational studies of over 35,000 people, those who used grapeseed extract had a 41% lower rate of prostate cancer. An even larger sample, over 65,000 subjects from the same trial, revealed that extract users also had 43% lower rates of leukemia or blood cancer. In many studies on rats and mice, grapeseed extract prevented UV-induced skin cancer by blocking oxidative damage and inflammation. This extract also inhibited the growth of many other cancers in lab animals, like colon cancer, lung cancer, prostate cancer, breast cancer, and liver cancer. Test tubes have also confirmed its ability to kill different types of cancer cells while supporting the healthy ones. Grapeseed extract consumption has been associated with reduced rates of prostate cancer and leukemia. Chemotherapy and radiation as standard cancer treatments are facing challenges, such as inadequate efficacy and significant adverse effects. Grapeseed extract boosted chemotherapy's efficacy in animal and cell studies. At the same time, it relieved side effects caused by chemotherapy and radiation, including gut inflammation, testicular damage, kidney damage, impaired immunity, and heart failure. In rats that were exposed to radiation, grapeseed extract maintained the level of crucial antioxidants and prevented lipid peroxidation better than vitamin E.